Well, it is an absolute joy and honor to be here with authors Lee Majewski and Yogacharya Dr. Ananda Balayogi Bhavanani, the authors of this wonderful book, Yoga Therapy as a whole person approach to health. And I can tell, you can see that I have even highlighted it. It's such a fabulous book, and I'm looking forward to having students read it. And today we're going to hear a little bit from Lee and Ananda about the process of this book. We can start off with, I know both of you, and I know both of you, both Ananda growing up in the ashram at the Ananda ashram, and Lee has spent, what, 10 years living in ashram?
Ananda is a born yogi. He was yogi through and through before he became medical doctor. So this is a open book of knowledge and an incredible bridging in his life between yoga therapy, and conventional medicine. So this is just a jewel.
Thank you, Lee, for that. You know, for those who don't know about it, before I get into a bit about what the bigger picture is, I think you should know a little bit of the back picture. And that is, for me, Lee is often my Canadian mom. So it is a personal relationship that has been there for many years and has evolved into this beautiful book. When we talk about yoga, for me, yoga is something that has to be part of life. And the reason is that my whole life has been a life of yoga.
I know both of you as embodying yoga and showing up as a yoga therapist as both the embodiment of yoga plus the science. And this book, to me, seems to bridge that science and the essence of yoga that I know we've all talked about is sometimes left by the wayside. If somebody's deciding, I'm not sure if I want to buy this book, is it for me or not? Is this something that's going to help me? Who did you write it for? And is there a take-home message you want them to have?
Actually, I think anybody who reads it can go away with something. I don't think there's anybody who would not benefit from it. I'm not saying it because it's our book. I'm saying because of the way it's come together. If it is a healthcare professional, it will open their eyes to the fact that yoga can play a role and answer a few questions of theirs, how it will play the role. And at the same time, help them see that it's not just a quick fix. So the healthcare professional will get their message from it. A yoga therapist who's already working in the field, they will get a chance to expand the perspective to move from yogapathy to yoga therapy. And I'm sure anybody who's already working in the field, it will help them expand the perspective. For those who are looking to practices, there are a huge number of practices also there. So someone who says, what are the practices I can do? They get that also. If somebody says, I want to set up a 3-week residential program on yoga for chronic diseases, they will get a model that then they can adapt to their environment, their working situation. For a yoga teacher who wants to expand about yoga, wellness, therapy, they will get a lot of information to upgrade their knowledge. And for a common person who is just taking it up for the first time, they will get an expanded perspective that, oh, yoga is actually so much of this. It is not just a keep fit exercise. And if it is a caregiver for someone who is going through chronic diseases, cancer, it will help them understand as a caregiver for their care seeker, how they can also be part of the process. And it's like we have two eyes. When we look through one eye, we see one dimension. When we look through the other, we see another dimension. But you have to have both eyes coming together to create the 3-dimensional perspective that we have in life. So for me, I think the integration between yoga and modern medicine makes so much of sense to me. which is what we have again tried to share in this book.
Dr. Ananda, you speak a lot about yogapathy versus yoga therapy. And you know I'm going to ask you this because it's something that you've brought to all of us. And I think it's the essence. I could read it, and reading the book, I could hear that message coming through. Is there anything that you would like to elaborate about
Actually,
that?
Again, a vision that Lee and I shared together, because we have spent so many hours and hours sitting and talking, be it at Kaivalya Dhamma or be it, in so many ways. But I think one issue that has struck me a lot in modern times is how, as yoga and yoga therapy became mainstream, people tried to fit yoga and yoga therapy into an already existing system. And that existing system is basically symptom-based. Get the person to feel better by reducing the symptoms, and you have solved the problem. And so we have come into a system, a modern system, which is looking at, you have a headache, I give you a drug for that headache. Now you don't have the headache, you can go home. But actually you still have the headache. You have the cause that has given you the headache, but because you took something to numb yourself, you now think you don't have the headache. You still have it. The cause of the headache still exists in you, in your life, in your environment, but you think you are now fine and you say that drug worked well. So when we came into that system and we brought yoga and yoga therapy, everybody was saying, which is the one practice for diabetes? Which practice will help in asthma? Which practice will reduce the headache and migraine? Can you bring down the blood pressure by your yogic relaxation? So what happened is people took an existing system, took yoga, which is expansive ocean, took it and said, here I have a cup and I'm going to put the ocean in the cup, and it started to become yogopathy. So yogopathy for me is yoga therapy in a box. Though I am highly critical of yogopathy, and I write a lot about it, I talk a lot about it, I understand it has a place in giving immediate relief to people. Someone has high blood pressure, you give them yoga relaxation, bring down the blood pressure, good. It is very good, but don't stop there.
It's not a prescriptive science. We spend, hours talking about it, but I have real problem with that because it is shortchanging something which is, to me, magic. When it is applied properly, the effects that it gives are fantastic. And in some instances, it can replace the traditional medicine, which has no answers for diabetes. It has no answers for non-communicative diseases.
I think what Lee has brought up, Laurie, is a very good point, that in the chronic diseases, non-communicable diseases, modern medicine, as a modern medical doctor, I have no answers. I have no answers to psychosomatic disorders. I have no answers to disorders that require lifestyle modification, because all I'm doing is, again, just trying to, what I like to say is the dam has burst and we are plugging it with, toilet paper. That is actually the visual metaphor I have for what we are doing. And it's never going to be long lasting. So we need something that changes the person from inside out, transforms their life, transforms their activity, transforms their thinking, and transforms the individual.
People change their lifestyle. People take ownership of their health and life. And people take ownership of their own healing with yoga therapy. This is a huge change of paradigm. Whereas you go to a traditional medicine, you are patient and doctor has all the power. Whereas when you deal with yoga therapy, there is this switch, which takes actually time because people need to understand and feel that they can actually be powerful and change their own destiny.
The change has to be for you, by you and of your own effort. And people often initially are a bit skeptical of it because they are so used to having somebody fix it for them. And here it is you trying to fix it for yourself. But my father used to say, if you want to be healthy, do healthy things. If you want to be happy, do happy things. And he said the problem is people want to do unhealthy things and be healthy, do unhappy things and be happy. It's a very big change. The paradigm shift is so gigantic that it is a struggle to fit it into another system.
So can you talk a little bit more, because in the book, I think just as you said, it's hard to fit it all into this package. I'm sure it was hard to fit this all into a book, what you're trying to convey. And I saw in the book that a conveying of a message of both how you assess somebody to find out both what the root cause is that you both mentioned, trying to get to the root cause, also the root thinking cause, like what is, and that's where the yoga comes in here, right? Where's their process that's even taking them to this root cause, and that's that transformation that you speak about.
I think, you know, when you start actually working with human beings, we realize you are not working with a diagnosis.
No.
You are working with an individual.
Yep.
And the whole medical paradigm has sort of limited the individual to being a diagnosis and a set of laboratory tests. And so most of the time, we are not even bothered whether there's an individual there or not. You have a name for the diagnosis, you have the lab results, and you give them the treatment. It is not about just relieving the back pain. It is not just about relieving the, you know, the migraine or the hypertension or making the blood sugar levels better. It is about a sense of, I am healthy. I have a sense of wellness. I am in a good place. I understand my life better. I can manage it better. My life has purpose. When we run our 6-month yoga courses, we call them yoga teachers training, but they are actually more yoga sadhana. And it's about the person immersing themselves from morning 5 o'clock to night 10 o'clock in yoga for 6 months. And the first month is where we do a lot of the cleansing, the physical, the mental, the emotional cleansing practices in our tradition. And that's where they hit the wall. And that wall, I tell you, we have to be aware of it as a therapist. Otherwise, we think, oh my God, this is a yoga injury. And this is where we have to be very careful, because people think it's a yoga injury, and people say, I was perfect till I came to yoga and now look at me. Yes. And I'm like, no, you had the headache. The paracetamol had numbed your headache. Now you don't have the paracetamol. So now you are realizing the headache is there so that you can deal with it. Mm-hmm. And it is a very, very important place where if the therapist doesn't know it, now because Lee has been through the process, she knows that wall. She knows you're going to hit it and you have to go past it. She is able to counsel and mentor. Here the process of mentoring as a yoga therapist. A yoga therapist has to be able to mentor the client.
Which brings us to the importance of having your own sadhana. Always going through your own stuff so that then you can help others. You know, yoga, you cannot learn yoga therapy in the book, by the books. You cannot learn yoga therapy from anybody. You have to experience that, and you can experience that only and only if you do your sadhana. And that's why
it is the most important chain.
Yes.
It is the most important link in the chain of yoga.
If I don't do my own sadhana, I'm of no use to anybody.
I'm wondering if you both, this is a really important point. I'm so glad that you're bringing up. It's on one of my big key pages here that I just love from what you both put together here. And this is just one example of it, which is a suggested personal checklist for yoga therapists about qualities and ways for a yoga therapist to show up when they're working with clients, because we were just talking about what the client experience is, and I think, and what you're talking about now is, what does the yoga therapist need to embody in order to be able to support and accompany a client through their yoga therapy process?
Ananda, I always look at you as somebody who practiced sadhana since you were 6 months old, right? Because you were born into Guru family in the ashram.
Actually, a small correction. It has to be from the moment of conception.
That's right. Yes.
You're conceived in yoga.
Yes.
Because I always say I was conceived in yoga because both of my parents were living yoga.
Yes.
They were practicing yoga. They were examples of yoga as a 24-hour living process.
Yes.
So for me, you know, I think the most important key aspect of one's personal sadhana is to realize that yoga is not only the practices, but also the philosophy, the psychology, and the spirituality. Modern medical system is based on have an objective analysis, and you know the client is separate, you are separate, you are treating someone. And when we try to do that in yoga therapy, it's going to move towards the yogapathy side. And empathy is a key component to be a competent yoga therapist. One is intelligence, second is empathy. Because intelligence is you need to see what is happening, have the metacognitive objectivity to be able to analyze what needs to be done. But then through the heart, you are connecting to the individual.
And third component, if I may come in, is that you are not healing anybody. You are not treating anybody. You are walking half step behind your client, understanding which way the client wants to go and what works or not works for that client at any given moment, so that we are not leading anybody anywhere. It is client that is leading us in the direction the client wants to go.
I think this is a very important aspect because, you know, as a medical doctor, I am expected to create a protocol and take the person there. And we are starting to do that with yoga therapy also, where we say, oh, what is the protocol for cancer? What is the protocol for diabetes? And then, you know, you are sort of leading them there. I think it is so important, as Lee said, that you are with the person, and giving them the choices, but they are the ones making the choices. You are not choosing for them. We are the support system, but they have to do it. We are not the doers.
In this paradigm that you're both explaining, both in the book and in your embodiment in life, and I hear you talk about spirituality, philosophy, psychology, and if we look at that as those are those transformative aspects, which is what you're talking about, the transformative capacity of yoga therapy. And yet we see a lot of the, what's the practice for this? We see practice for this. So I'm curious if you were to speak to, let's say, to share this book with healthcare providers, to say, hey, here's an approach. What might you add in and to choose a yoga therapist, here's how I would suggest you might choose that. Does that make sense?
I would first ask if the yoga therapist has sadhana. That would be my first question. Then you ask them what sadhana you doing and how did it change with the time? You know, because we don't go on the mat and do the same set of asanas. Then I would ask, what was your experience with healing? How did yoga therapy help you heal? Those who are really living it have that experience of being helped by yoga therapy.
And through that, you're then showing up for your clients or your participants with that.
Exactly, with your own experience.
the most important message I would like to give people in this is, it is not about what you think the other person needs, but it's about finding what the other person actually needs.
Yes. If I may add to this, that healing does not necessarily mean curing.
Mm.
And I want to tell you a story about this guy that you have sent, Ananda, to me just 2 days before, who came from Canada. He had lymphoma in last stages. He was denied, medical doctors told him, we can't do anything for you. You know, you've got maybe 2 or 3 months. And he came to India to this retreat. But he came with a lot of anger, a lot of fear, and a lot of regrets in life. And with a fear of death, of course. After 3 weeks, he said, I'm not afraid of dying. I'm going back to spend the rest of my time, as much as I have, with my sons. And I will just enjoy every day as it comes. Now, 3 or 4 weeks later, he died, actually. He died in Vancouver. And he died with no regrets. He died surrounded by friends. About 1.5 years ago, I sat and I thought, do I want to start these retreats in North America? Do I have yet energy at my 69-year-old life? Do I have energy to start something new again? Do I want to do that? And I'm sitting, and I was down, and I thought, maybe not. Maybe I'll just be retired, enjoying the life. That evening, an email comes to my computer, and I open the email. I don't know the name. I open the email, and email reads, you don't know me, but I'm a wife of one of your patients who did your retreat 5 years ago. And I just wanted to tell you and thank you, because Harry came back home. He was completely changed. He died in peace. And he always said that this is thanks to yoga therapy retreats that he attended. Now, I'm sitting here, I'm thinking, I won't do it anymore. And this email comes in, and it's like, oh, okay, I'll do it. But I had to ask her, so I wrote an email to her, and I said, and I described the effect of her email to me. And I said, can you tell me why, after 5 years, you send the message to unknown person you never met with this information? And she says, I don't know. I just felt that I need to tell you.
The universe really knows what we need to do.
Healing does not mean curing. He went back home healed, without fear, without guilt, without all that stuff that he came with. He left it. He worked it out, and he went back in peace with himself and the world. That's healing, but not curing.
It's so beautiful, Lee, when you talk about this, because all of us are human, and we have those moments where we wonder whether we should be doing what we are doing. Yeah. And we feel down on ourselves, and we are like, is it all worth it?
Yeah.
And I'm like, shouldn't I just be a regular doctor prescribing drugs and injections and get on with life, rather than trying to be this oddball that sort of sticks out like a sore thumb at times?
Is there anything for somebody who's working with a person who's not at end of life that you might want to speak to about spirituality in that? I think it's a really important piece.
The thing with spirituality is that people are still connecting it with religion. And it's only just recently that researchers started to put division between spirituality and the religion. So now there is more and more research papers which are looking at how spiritual component in yoga practice is enhancing the results of the effect of yoga practices. That's one thing. I believe that the biggest value of yoga therapy is its promise of spiritual transformation. I say it's a promise because it's not given, because we have to remember people have to practice. We are not causing, we're not fixing them.
Yeah.
And people have to practice, people have to want to practice. And it's only with the practices and time that spiritual transformation is happening within them. I believe that yoga therapy has that potential and carries that potential for people who do not believe in God, do not have a religion, and yet they feel that need of change, a deep change, and finding themselves, the quest that you need, something is missing, that you have that hole in your heart that you want to stuff with food or cars or possessions, and at some point
toilet paper.
At some point you discover that hole needs something more than, and then you're looking for it. And at that stage, yoga therapy has creates such a fantastic opportunities. But at the same time, for us as a therapist, it's such a honor and great responsibility in guiding people on that path. So that's why I'm saying, I always walk half a step behind, not in front, half a step behind, watching which direction the client wants to go.
Beautiful.
Right.
When we talk about spirituality, I think, as Lee said, the issue is people confuse it with religion, which is where I like to sort of communicate with people that it is about a sense of connection. Spirituality is all about a sense of connection to something greater than you as an individual.
Yeah.
Now, what that is, what you call it is your business, not my business. So all of us have something that is bigger than us as an individual to which we feel connected. It may be even science, which is the new religion. So some people connect to science, fine. That is their mode of spirituality, which is why I love Einstein, because he brought science and spirituality together. In his last days, what he was talking about scientifically was pure spirituality. What I like to tell people is that you don't even have to think about spirituality. You don't even have to talk about it. As you start doing the yoga practices, this is where the yoga practices put into action, and you are moving from being in pieces to a state of being at peace. This is what the spiritual message of yoga is. So every time you do an asana mindfully with the breathing, every time you do a pranayama and you connect to the life force of that beautiful energy of prana, every time you sit for a deep contemplation that people like to call meditation, every time you chant a mantra, I think this coming together that happens in every practice of yoga is what spirituality actually is when we put it in action. So that is the spirituality of yoga. It lies in everything. And if it doesn't lie in what you are doing, the question is it still yoga?
I think as I'm hearing this, as you're saying this, I'm hearing there's this trust for both the yoga therapist, particularly, to trust in the yoga. So when somebody has that experience, instead of trying to tell them what it means, is that stepping back, as Lee was saying, and trusting that their own intuitive wisdom is going to recognize what that is, because they've had that embodied experience of something beyond them. And that's where we get to recognize that we're not doing the fixing. We shared a practice, they had an experience, and then we get to get out of the way and let them.
You know, I never, at the beginning of those retreats, I don't explain anything. I just give them practices. And by the first week, end of the first week, when they start having experiences, then they ask. And then you can start talking. But I just tell them, just do the stuff. Just do this stuff and see what happens. And inherently, after having an experiences, and sometimes these are very deep, moving experiences, they come back and they say, what happened? What happened? I say, well, yoga therapy happened.
And there was this German girl, and she was like, maybe yoga works, but not for me.
Yes.
This is the thing. Maybe yoga works, but not for me. Maybe Ekadasi works, but not for me. Because others are having, I am not having any of these experiences. I am just breathing. I'm just doing the technique and fine. I said, okay, no issue. I said, and we went on. So we went on into the third month, and the fourth month, one of our old Indian students who had trained with us from a kid, she had joined in late. So she missed the first month of the training, had come in second month. So we said at the fourth month, you have an opportunity to again do these cleansing practices. So when this girl was doing, this German girl said, I will also do with her for company. I said, okay, no problem. And I remember in the middle of January, I was in one of my afternoon sessions, and I noticed this German girl, she was crying, and I could see the tears coming. I could see a lot of things, and I'm like, what's happened? So at the end of the class, I went up to her and I said, what happened? And she says, yoga works. Ekadasi is working. So I think when we talk about yoga practices working and the people having experiences, we need to keep in mind it may not be the experience that others had. It may be a different experience. And be open to learning from that experience, searching for the whys and the hows of that experience, and then seeing how the bigger picture can come alive for that individual.
Well, this is wonderful. And I want to thank you both, for everybody, for sharing your wisdom in this book with all of us. And before we wrap up, is there anything that you want to, last words of wisdom, any pieces you'd like to sum up from this chat about this book that is about to be revealed to the world?
I think the most important message that both Lee and I share, and we share with the world through this book, is that yoga therapy is not prescriptive. Yoga therapy needs to approach the human being as a wholesome person. We have to understand the body, mind, emotions, and the spirit, and that yoga works in a multi-dimensional way to transform the individual. I think the core message is, do not limit yoga to a box. Let yourself come out of the box. Let yourself become the best you through the practices of yoga is actually what this book is about. Finding yourself, getting to know yourself better, and connecting to that greater oneness of which you are an important, vital component.
Beautiful. Thank you. Especially during these COVID times. This is so valuable. Yes. Thank you. Thank you both.